They're notorious among golfers. They can ruin a perfectly good round with one little twitch. They're the yips, and they can really mess up your mind and your golf game. Researchers at the Mayo Clinic have been looking into what causes the yips, and here to talk about the study is Dr. Charles Adler, a Mayo Clinic neurologist and researcher. Good to have you here. Thanks for joining us.
Thanks for having me.
Let's define terms here. What are the yips?
The yips is a description of people who putt or chip and get an involuntary movement. Usually they describe it as being a twitch or a jerk or sometimes a tremor.
And this is, you say putting and chipping. Some folks say you can have the yips. Some people think they have the yips with a driver. Possible?
I think it's possible, but traditionally people have talked about it mainly with putting and chipping.
Okay. Yips is traditionally, it's another word for choking. Accurate?
I think that it is accurate in many golfers that performance anxiety and choking is one of the causes of the yips. What our research is geared towards looking at is whether everybody is more of a psychological or neurological type of yip. What we believe in is that there are a number of golfers out there who have a golfer's cramp, much like musician's cramp or writer's cramp. So it's actually a neurologic disorder.
So it's a neurologic disorder, but why would, I mean, it's not the kind of thing that if you're walking down the street, your hand goes like this. It's only when you're holding a puttering and you're trying to do, why then?
Well, I think we would both agree that if you saw somebody whose hand shook,
yes,
just as they're sitting here, that you wouldn't be surprised that their hand shook when they were golfing.
Yes.
So the research we're doing is people, like you said, who don't have a movement disorder when they're just walking around. And it's just during that task. And we call this a task-specific dystonia or task-specific movement disorder. Again, musician's cramp, people who play the violin, people who, I have a drummer, people who write. And as they're writing, only when they're writing, no other activity, typing, using their hands for any other activity, only when they're writing do they get a twitch, do they get an involuntary movement of their hand.
Now that suggests overuse. You understand, with the musician with the cramp and the writer just writing so much your hand freezes up or cramp. Overuse here in terms of putting?
There's a lot of discussion about it being overuse, yes. Nobody's ever proven whether any of these task-specific dystonias are truly due to overuse. There may be a genetic predisposition, and then in the setting of overuse, that's when they get it. We all write, yet we all don't get writer's cramp. Many people play an instrument, yet don't get a musician's cramp. Same thing here with golf.
Talk about the study, what you studied, and how the research was conducted.
So we did a study a number of years ago where we took 10 people who complained of the yips and 10 who didn't. We had them in the lab at Mayo Clinic, and we studied hand movement and forearm movement. This study was done out at ASU at the practice green at Carson Golf Course. With my colleagues both at Mayo and ASU, we studied 25 golfers who complained of the yips and 25 golfers who did not. And we videotaped them. We had surface EMG, which is an electrical recording device to look at movement of the muscles and contraction of the muscles. And then we had them wear a glove, which measured joint position at the fingers as well as the wrist, and also measured rotation at the wrist.
Did you find that those with the yips, did they grip tighter? Did their grip change throughout the putting stroke? I'm trying to get this neurological kind of situation down here because, again, some folks think that the yips, I actually read this once where a putting instructor thought that the yips were when you take the putter back, you're thinking you're aiming too far in one direction. So your mind is saying, compensate, 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 and by doing that, you start poking at it.
Correct, and I've read that and I've talked to people about that as well, and I can't say that that's incorrect. So in the research that we have done, what we've done is we've identified a number of individuals that have an excessive amount of rotation around the wrist. Some of them also have co-contraction, so their wrist flexors and extensors contract at the same time. People who don't complain about their yips mainly do not have that. So we think there's a percentage of people, 10, 15, 20%, maybe a little bit higher, that actually have a neurologic cause for this as opposed to a performance anxiety or choking cause, as you've described.
And this would be, again, it seems as though you don't hear about young people having the yips. You always hear about the older guys that are out there and they're complaining about the yips and they got the belly putter because they can't, they just can't. If it's neurological, why don't we see more young folks out there with this?
This would follow. This would follow in line with all of these other sorts of movement disorders. Movement disorders occur as one ages. Think about tremor. Think about Parkinson's disease. Think about people who have writer's cramp and musician's cramp. Similar sort of pattern. Usually occurs in their 40s or 50s, maybe in their 60s, in terms of when is the onset. So same thing here.
Okay, so what kind of treatment are we talking about? I mean, I know it's still early in the study, and this, of course, is looking at golf, but you're learning things that affect other areas of life here. But as for the golf aspect, what do these folks do?
Well, the first treatment, first of all, the study was not a treatment study, so we didn't actually look at any treatment modalities. That's the point of what I hope will be the next study. Treatment options, first treatment option, again, as with the other types of cramp, is change your grip. Use a longer putter. People say, well, doesn't that prove that it's not neurologic? And the answer is no. If you have a writer's cramp patient, we often change the size of their pen, how they grip their pen to try to get them to compensate. Pills, various different oral medications can be tried, and depending on the patient, there are a couple other options. Botulinum toxin injections have been used very successfully for writer's cramp and musician's cramp. And there's even surgical intervention now with something called deep brain stimulation surgery. I'm not saying that should be used in golfers.
That's what I was going to say.
There is one golfer who has had that, a professional golfer. So that's something that would need a lot more study. But that's way down the line.
Very quickly, if someone has the yips, is that a concern? Is that a health concern?
I think the answer is no.
Okay, very good. Well, thank you so much. It's absolutely fascinating. Thank you so much for joining us. We appreciate it.
You're welcome. Thanks for having me.